the reason women are more prevalent to having cancer?
Those risk factors, they actually start in their late teens and 20s. Just imagine a celebrity, any social media influencer, giving these tips that you have to apply these different cosmetics. They are exposed to all these chemicals without knowing the side effects.
If there was one lifestyle change every woman should make to reduce her risk, what would it be? Hello, everyone. Welcome back to In the Making, where we have uncovered the boldest, most game changing stories in health beyond. Today, we have an extraordinary guest all the way from Pakistan who's on a mission to revolutionize women's healthcare, Dr. Jawad Mustafa. With over 19 years in medical practice, Dr. Mustafa saw a glaring gap in how our healthcare systems treat women, especially young women. His groundbreaking work through his NGO, Be Breast Aware, is focused on empowering women in their 20s and 30s to reduce the avoidable risk factors for breast cancer. This isn't your typical healthcare conversation. It's about prevention, empowerment, and educating the generation that's often left behind, the young women. If you're ready to hear how you can take control of your health and avoid life threatening risks, this episode is for you. Let me introduce my guest, Dr. Jawad Mustafa. Welcome, Dr. Mustafa.
Thank you for the great introduction.
Dr. Mustafa, Pakistan has the highest incidence rate of breast cancer in Asia. According to estimates, 1 out of 8 women is likely to get breast cancer in her lifetime. When I researched, my mind was blown away. Why do you think breast cancer is so prevalent in this region, and what can be done at the community level to tackle it?
Well, this 1 in 8 women figure is about globally. In some countries, it is bit more. In some, it is bit less. But there are a couple of trends which are changing. This 1 in 8 figure, it doesn't give us the exact clue about what is happening around us. One in
Hmm.
eight is the figure for those patients which are diagnosed. Those which are
Got it.
not documented, which are not in the healthcare system or registered, their number is far more and far severe. And all
Hmm.
the issue is about the detection of cases in the younger females, contrary to the regular perception that breast cancer occurs in the 40s and 50s and later. So
Yeah.
it is true to some extent that the risk factors increase as women age, but those risk factors, they actually start in their late teens and 20s,
Hmm.
because excessive hormonal changes, those environmental exposures, those toxins, radiation, their exposure is more in the younger age group. So
Yeah.
1 in 8 is the right figure, but it has many components which are involved and which are more alarming.
We are talking about a very important topic here. It's not just about access to healthcare, it's about shifting the conversation to awareness and preventions in regions where these topics are still stigmatized. You work with many young women who are overlooked by the healthcare system. Why do you think there is such a lack of awareness and guidance for women in their 20s and
The problem is with the healthcare system globally, not just in Pakistan, India, or in the underdeveloped countries, like even in the States. The screening process starts after the age of 40 years. A female has to qualify for this age group to be screened, but
True?
nobody is telling these females who are in their late 20s or 30s that the risk factors are there for you also. If you are having any kind of issue, then you should go for a screening process, not for the mammogram
Yes.
but for the ultrasound. But even if you
Hmm.
are not having any kind of symptom, any sign, you don't know what's cooking inside. If
Yes.
it is not evident, if it is not visible, it doesn't mean it is not present. No healthcare system is providing risk factors which trigger a disease process. In case of
Right.
breast cancer, those processes are linked with diet, with poor nutrition, with poor immunity, with hormonal imbalance, with
Mm.
surrounding our chemical exposure, those
Right.
chemical and food items which we either ingest or apply to the skin. They all have some kind of carcinogenic activity, carcinogenic potential that can trigger cancer cell formation. So unless we are
Yeah.
providing them with the basics, every age group, every community, every country, they are at having they are at a risk. So it is not just about demarcating a certain age group or country. It is about providing them with the basic knowledge that you have to start caring for yourself, even if you are not in the screening group or in the danger group. Those factors which trigger these changes, you are constantly either inhaling them, ingesting them, or applying on the skin. So this 1 plus 1 effect, they will have their effect in your 30s and 40s, which you are doing at this moment in your late 20s. So this is lacking in our healthcare system.
I don't know about that, Dr. Mustafa. As much as there is so much awareness about cancer these days, you mentioned a very important thing about applying things on your skin also affects cancer in different ways. Uh, so there are two questions for you here. One, a lot of people talk the breast cancer or like cancer in any form is carried to your genes, so it can go to different generations in your family. And second, you mentioned that when we are applying something to our skin, which could be cosmetic products, makeup, and women are more prevalent to those these days. So that's the reason women are more prevalent to having cancer.
Skin is the largest organ in our body, because from head to toe, skin can absorb different chemicals. It has tendency to absorb anything that is applied to it, which can permeate the skin layers. Let's imagine a scenario in which a female, like in the previous decade or so, social
Mhm.
media was not so much evolved. Access to communities, the access to other person, it was very limited or less. So
Right.
when this, with this advancement, with this extra exposure, girls, they are making their social media videos, those cosmetics which were used in the 20s and 30s, now girls are applying even before they are in their teenage. The body has to metabolize these elements which are absorbed. Not every skincare product is standardized. Not every skincare product has the natural components. It has
Correct.
different chemicals to increase its shelf life, to add to its bulk. So just imagine a celebrity, any social media influencer,
Right.
giving these tips that you have to apply these different cosmetics. A person, a
Yeah.
female or in her early teens, sitting in India, in China, or in Philippines, she doesn't have access to those chemicals, those skincare products which are standardized. She will get
Right.
those items which are available, but they will have mercury, they will have all kind of sulfates, they have parabens, they will have BPAs, all kinds of those chemicals which are harmful. So
Right.
that influencer may not be using those products which have these chemicals, but she is influencing hundreds and thousands of girls. They are exposed to all these chemicals without knowing the side effects. As the
Yes.
exposure is increasing, the health hazards are increasing. First of all, you have to tell your younger females, it is not just about a certain perception to look like a
Right.
certain way. You have to be presentable in your own manner.
Yes.
It is not evident at this moment, but the next decade, this will be a really alarming figure. And I fear that this 1 in 8 figure can come to 1 in 7. So
This information. Thank you for sharing, Dr. Jawad. The assumption that breast cancer, only affects older women is a dangerous misconception, and your work is such a big proof that prevention has no age limit. And when I turned 40 is exactly when I was asked to do a mammogram the first time. But at the same time, I have friends who in their early 30s got cancer. As women, we are playing so many roles in our life that taking self care comes last for many, many women in today's world. In your experience, can non cancerous lumps lead to cancer? Could you share a story from your practice where a benign condition escalated to something more serious?
there are many stories and many cases, like a girl in her late teens, a couple of my patients, they had lumps. Everybody told them, don't worry if there is a lump or two, just keep checking it if its size change or if there is any other symptom.
Hmm.
Very common misconception by healthcare professionals that if the lump is moving, just don't care about it. In my patients, one of them was in her early 20s. It was a mobile lump. Everybody told her she don't care about it. When I did the ultrasound, I noticed that there was something wrong in the ultrasound scan. I told her to get a biopsy. Ideally, you should get it removed. Whenever I
Right.
get some suspicious lump, I just tell them straight that get it removed. Don't wait for
Right.
the biopsy and then wait for the decision and that, because in states and in UK also, it is a long process because you are not
Mm.
in the screening group. No physician or no surgeon will take you serious unless it is proved in the biopsy. So from the
Right.
first presentation till the biopsy results, this process can take up to 3 to 4 months or 6 months. Couple of my patients from states, one from Norway, they had to go through all this process, and it took them months to get the diagnosis that it is cancer, which was
Wow.
told by every person that it is non-cancerous cause, it is mobile, you are not in the risk age group, you don't have any family history, so just forget it. So
Wow.
just ignoring any sign or symptoms, it is
I
not the
agree.
answer. It is not a universal rule. You turn 40 and something triggers. We have to realize humans are not machines. Everybody has different exposures, everybody has a different lifestyle, different hormonal balance, different immunity. To
Wow.
unlock any kind of disease process or cancerous process, stress can work as a key and a trigger, because
Mm.
the body is trying to cope with this situation, but when stress strikes, it inhibits or reduces our defense mechanism, and at that moment those cells which were already in balance with the good and bad,
Right.
those good cells, they are inhibited, and that disease process it's suddenly erupts.
Wow. I mean, it's incredible information, Dr. Jawad. This is really a big learning for me. When we go and buy makeup, we still choose comfortable stuff that we are used to rather than going for a little more expensive organic stuff, which is genuinely made with real products. Like we say, prevention is better than cure. I guess we all have to learn this from you today. You've witnessed heartbreaking moments in your clinical practice where women were let down by the system. Can you share any story that had a profound impact on you and shaped your mission to start Be Breast Aware?
There were a couple of cases, like one case few months ago. She was 19, 20 years old girl, and she came with severe pain in her breast. Her mother gave history that it was a stinging pain, discomfort for last 4 to 5 days. She kept telling her mother that there is some pain, discomfort which was not present earlier. Her mother just told her to apply some skin ointment. They actually went to a female doctor a couple of days ago before they visited me. She told these discomforts, they happen in younger age groups due to hormonal changes. Don't worry about it. Wear a tighter fit bra cause it will actually put pressure, and it will suppress those ducts which are either engorged due to any reason. And that pain escalated.
Oh.
She was in agony when she visited me. When I did the examination, there was actually a skin crack on the nipple area, and in ultrasound, it was abscess, pus formation under the skin, under the areola, just because it was a small skin crack earlier that was giving her discomfort and pain. And when she didn't apply proper skincare ointment, she didn't keep it clean, that crack turned into an infection source. And coupled with that tighter fit bra, which
Yes.
completely blocked those secretions that were actually pouring out small drops of secretions, so that turned into a full blown abscess. It took a whole week of antibiotics to actually heal that wound, for that pus to drain, and that process took 2 3 weeks. And
Wow.
many such cases and many such younger females, just due to ignoring simple sign symptoms, due to misconceptions and simple home care tips which are not actually helpful, and
Right.
lack of guidance from the healthcare professionals also. I must say that.
Wow, this is really eye-opening, Dr. Jawad. Coming from an Asian country, India, where yes, we believe in a lot of systems and practices that are holistic, homebound, and we want to not take help of medical professionals. I lived with a medical professional all my life, so I saw both worlds. Where my father was a doctor, and and at the same time, my mother also believed in doing some home practices, and they both are important in today's world. But if you know the balance of who and why and what, and at what time you need to go to a doctor, and what's the harm in this situation, like you said, the girl was genuinely in pain. I think if this was happening to me, my dad would have taken me to a doctor. He would have not asked me to do and said about the hormonal imbalance, wearing a tight fit bra, because as a doctor, as a medical professional, he understands the depth that can a pain can trigger and why the pain first of all starts. These stories show us that healthcare isn't just about treating a disease; it's about empowering women with the knowledge to protect themselves. It's great information. With 19 years in medical practice, what have been the biggest myths surrounding breast cancer that you still encounter today? And how do these myths hold women back from taking preventive action? I know you've already mentioned a few right now with us, but is there something that we have not covered and you would like to share?
Well, the biggest myth is that if we are not feeling any problem, we are safe. Because it is not just in the Asian countries. Globally, it
Correct.
is a trend that whenever you are not in that particular age group, whenever you are not having a particular history, family history, so you think you are at a better chance of having a normal, healthy life, which actually
Yeah.
is true. It does happen. So, but the problem is that if you are not checking yourself, how you can be so sure about it? I always tell my patients that you don't have to always go to a doctor to get your ultrasound or mammograms done. There are simple ways, simple methods and tips that I guide and teach every of my patient in the clinic. There are some steps that you do on a daily basis. They don't require a lot of time. Just a simple 1 minute look at yourself a daily whenever you shower, whenever you change, or whenever you are standing in front of a mirror. That 1 minute can be a lifesaver. Whenever you do a self breast examination, those steps which are advertised in the social media and the campaigns, they don't give us the whole picture of what to
Right.
do and what to find. It is not
Yes.
just about finding a lump. Lump
Yeah.
is one component of a disease process.
Correct.
So we have to shift the focus from breast cancer awareness to self breast awareness. I'm trying to aware them about self breast care, self breast awareness, and those methods and tips they can apply on their own without going to a doctor, without purchasing anything. Those are
Right.
holistic ways. You combine these to learn a balance in which you can try to keep yourself safe, healthy, and when you feel problem, you go to a doctor. Unless
Hmm.
you are examining yourself on a regular basis, you don't know what normal is, what is normal for you. It is not something that any other person can do for you. It is
Yeah.
your own care for your own self, and nobody else can interfere in this.
These suggestions. They are very powerful, they're groundbreaking, and every single person needs to hear this. Um, with AI and data revolutionizing healthcare, doctor, how can we use technology to detect breast cancer earlier? And how do we ensure that young women have access to these advancements?
The most important is to keep reading, keep watching new
Mhm.
stuff, to have an idea of new factors, new triggers.
Right.
If a female doesn't know what are the carcinogens in her cosmetics, when
Mhm.
she learns, she can adopt those changes. The same way, if she doesn't know which food items make her healthier and which make her sicker. So, on a
Yeah.
daily basis, on a regular basis, whatever you can change or modify or reduce. Suppose your work demands you to sit for 6 to 8 hours. It is an
Right.
unavoidable, but you can learn those exercises, those simple massages, and those simple tips that can reduce the effect of that unavoidable risk factor. So
Right.
you have to learn how to adapt to your environment, your workplace, your routine, to make it a better suitable alternative for yourself.
Right.
So there are AI models that can help in detecting small lumps in mammograms. You give them a query and they give you answers, but those answers will not be a human mind answer,
Yeah.
because human
Yes.
mind gives you possibilities. It has a background knowledge that something bad was happening to you a couple of years ago, it may have an effect now. It doesn't know that.
Right.
So whenever you ask AI a question, just keep in mind that it knows you from at this moment till the time you are interacting with it. It doesn't know your history, your background.
That's
So AI can never replace a human mind, a human touch. It can never replace that.
people forget that humans have created AI. So humans are still going to be more powerful than a robot is. And like you said, it only knows the current information that you are feeding into, but they don't know about your personal health, your personal life challenges. So it's very important to take guidance from a real professional. I also feel that prevention is power, and it's time we stop thinking we are too young to care about our health. You've always talked about empowering women to be their own advocates. Um, and that's the reason you started Be Breast Aware, to create more awareness for women in their 20s and 30s to take control, take power of their health. How do you envision a world where women no longer fear breast cancer, but we are equipped to prevent it?
Actually, we if when we are relaxed in our mind, when we know that we are in control, that's an illusion that we are controlling things. We cannot
Right.
control things. We can avoid the risk factors, we can avoid the things which we learn. So we
Mm,
learn actively by reading, by watching something. We learn passively from the experience of those which we encounter in our daily life, from friends, family members. So whenever we visit a person who is having cancer or breast cancer or any kind of disease, try not to judge them on their past decisions or their past problems or things they have
mm,
got. Try
that's
to
so
learn
nice.
from that they went through something that may or may not be their fault. Try to avoid those factors, that choices they made. Maybe that choice
Mm,
was good for them, but due to some unwanted condition, it turned bad.
yeah.
Try to make changes, try to make adjustment, learn from others' experience and mistakes, and also keep yourself equipped with the basics of things, basic knowledge that you can provide them hope, provide them with a better solution, provide them with a better actionable step that can
Right.
benefit them. Like a simple example, in
Yeah.
states, in Harvard or any university, if they are doing research on the carcinogens in the skincare products, they may not
Yeah.
know that in Asian countries, those items or those chemicals which USA has banned in the 70s, they are still using it. So they will not have the clue of what is going on, why a certain group, a certain community or country has so much high risk factors. One of the reasons why in Asian countries breast cancer and other cancers are on a rise, and particularly in the younger age groups. The role and use of plastics, microplastics, in Philippines, in India, in Pakistan,
Yeah.
in other such countries, that plastic is made
Mm,
from hospital waste, from that
wow.
waste which was dumped, which was sold, and that is purchased to make that plastic precursor that will mold into things. And those cheaper toys, those cheaper skincare products, those cheaper household items that we use and think that we got it cheaper, actually it is made from that waste which was dumped.
Wow.
So there are factors which many countries don't have at this moment. They don't have that kind of risk factor in their community
Right.
because they have dumped it.
Dr. Jawad, this has been such an incredible episode. And trust me when I say this, I have tremendously learned and opened my eyes today. I have, I hang out with a lot of women in my life. I know friends who have young girls as daughters. And for me to pass on this information and the work that you're creating is impeccable. It's just filled with so much value. I have some few rapid fire questions before we wrap up this episode, if you're okay with it. They are quick and quirky and a lot of fun. Um, so my first, if there was one lifestyle change every woman should make to reduce her risk, what would it be?
The best thing they can do for themselves is to reduce the avoidable stress.
Love that. What's the most overlooked factor contributing to breast cancer in young women?
Using unnecessary, unwanted skincare products.
I agree. I've been there, done that, and slowed down. I use only two doctor recommended products now. And I realize that the money that every woman invests from morning to night on skincare is so not important. My mother is still living with one skincare all her life, and she has the most flawless skin. Prevention or treatment? Which one do you think should take precedence in the fight against breast cancer?
The thing I'm doing, prevention, awareness.
You're so amazing, doctor. One more question for you. Is red meat contributing to more breast cancer or just cancer in today's world?
Was there breast cancer in the 18th or 17th century and 16th and earlier? It is not just about red meat. Red meat can't give you all those risk factors at a time. It is
Right.
about a balanced diet which can include a good portion of red meat in it because it is a source
Yeah.
of iron, it is a source of those minerals and which are necessary, which are required. It's a protein source which is very important for our body, building block of our muscles. So keeping things in a balance, in a proportion, they it can help. For certain people, it may be contraindicated. It is not advisable. But for a smaller group which may have some issue with red meat intake or high protein intake, but for everyone else, red meat along with white meat with a balanced carb with balanced fats. Fats are very important.
Right.
Never ever skip fats because they are the building blocks. They form the cell membrane. They form those hormones which are giving you a good skin, which is giving you a healthy overall look, and which is providing you proper growth. So skipping any component is harmful. Balancing those components, it's crucial. One simple example that any person can relate and understand: water is life. That water, if it is in excess
Yes.
or it is outside those limitations, if it is outside the heart, it will constrict it. But inside the heart, in the form of blood, it is life. So keeping things in
Wow.
balance, keeping things in harmony, every nutrient is required in the body, just in its proper proportion and at a proper time and at a proper place. So don't skip anything. Keep it simple, keep it relevant to your health, and don't copy anyone. That person is not living your life.
Love that.
That person don't have your hormones. It is not having your genes, and it is not having
Yes.
those thought process that you have. So every person is different, so don't copy anyone in your diet, in lifestyle, in your choices. Don't copy anyone.
My mom is going to love what you just mentioned, Dr. Jawad, about making sure you use the right fats, and which is ghee and clarified butter, as it said in today's world. I remember at a point when I used to reduce that in my system, thinking that, oh, well, I'm maybe consuming fat. And she would say, the reason at the age of 70 I'm running is because I consumed that fat all my life while growing up. In today's world where everybody wants to look great and feel great, they forget that some of these fats do add a lot of health benefits to your body. Um, so the stories you've shared today are a reminder that every woman deserves access to the tools and information that could save her life, and that's the kind of empowerment we need to focus. Dr. Jawad, thank you so much for shedding light on such a critical and often overlooked issue. And the work with Breast Aware is a reminder that all of us, have the knowledge is and we use it to our power, and prevention is the strongest form of healthcare. To our listeners, if there's one takeaway from today's episode, it's this: You're never too young to take control of your health. Don't wait for symptoms. Start now, get educated, and protect your future. Be sure to tune into more episodes of In the Making for stories that inspire action. Until next time, take care of your health and remember, prevention is empowerment. Thank you, and I look forward to see you next time.